Welcome back to the Star Online's live chat. With us here at Studio we have the Health Minister, Datuk Liow Tiong Lai. He will be answering our questions about the Influenza A H1N1. Datuk moving on into the next few months, we are going to see the winter coming in the northern hemisphere. So, are we prepared for it? Do you anticipate the situation getting worse from what it is right now?
Yeah, WHO did warn us that there might be a second wave. We won't know how it will come, especially this is a new virus. As you know, that new virus, we won't know that what is the level of fatality, a virulent level. At the moment, virulent level is about 0.4 to 0.5% mortality. But at what the rate goes now, we look at the pandemic situation because of the transmission is so fast, man-to-man transmission is so fast that even at the low virulent level, low mortality level, the number of deaths may increase. So this is our worry. And if we go to winters, we won't know whether the second wave will hit us more badly. So a lot of unknown, a lot of things that we have to go into further research. So what we have to do is to prepare ourselves. More precautionary measure must be taken. We cannot take this for granted.
But Dr. Sri, just wondering, the public out there would also like to know the proper procedures to check if they are H1N1 positive. So, I mean, what are the procedures like? How long should you wait until you're tested?
Yes. At the moment, we urge the public, if you have flu-like, influenza, flu illness, then if it is mild, then you can stay at home quarantine, and wear mask. We think that it's wear mask to prevent the flu from transmission. So if the symptom get a bit worse, quickly go to hospital, hospitalize, get admitted, and we have directed all the hospital to be on high alert on this. And straight away, when those people come to hospital, they must be tested influenza A H1N1. They must take the throat swab and test whether it's A H1N1. At the moment, we're going to increase more lab. You see, now we only have IMR and also Sungai Buloh lab. So we would like to increase number of lab at all the state level, so that at the state level they can state hospital they can send their sample to the state level, state lab. So we think that we have to increase our capacity. We have to get people to be tested for H1N1.
Right. Dr. Sri, back to the public. We had a reader who wrote in and saying that when he was in Singapore, he learned a lot about the virus, the fact that there were posters everywhere, even in the public toilets, and they're getting the necessary advice in the news. So and they even have like specific clinics for the H1N1 virus for people to go to if they have flu symptoms. So I just would like your comment on that. I mean,
so yes, in Malaysia we are doing the same. In fact, now we have increased our number of hospital and clinics to be tested H1N1. We also intensify our public awareness campaign. In fact, this month, for the next 3 months, this coming 3 months, we're going to intensify in all the radio, TV and media regarding the way and means to prevent H1N1. We are going to have more forums on the ground. We are working with other agencies like this higher learning ministry. We're going to have forum and discussion session with all the universities, their staff, so that they understand when this hit the university, they know what to do, and they are aware of the prevention measures. I would say that this is very important now. There's this campaign, this awareness campaign is very crucial. Everybody must know what to do when the pandemic hit the community level. So,
but Dr. Sri, we had another email from a reader who said that they visited the doctor, a regular doctor, and all he did was take her temperature and then, gave her flu medication. How sure are GPs that people who come in with flu do not have the H1N1?
You see, that's why yesterday my ministry issued new directive to all the clinics, hospitals, private hospital, that they must increase the suspicion level. They must have these, the index of suspicion on H1N1 must be raised, so that when people with this kind of symptom, they must actually look at the situation. If they suspect is H1N1, they must send the sample to our lab immediately. So I'll say that we now urge the doctors to take all these measures. So we hope that doctors can cooperate with us. We know it's important that the public also want to know whether they are infected by influenza A H1N1. So, but if it's a mild symptom, they don't have to worry, because if they feel that they have difficult breathing, coughing, having fever, then they have to go for the throat swab and make sure that they have to be checked and tested whether they are H1N1. Because if they have to know early, so that when they know they are H1N1, straight away they'll be given antiviral treatment. You see, when you are a H1N1 patient, the first 48 hours is very crucial. Once we confirm they are a H1N1 patient, we have to straight away give you antiviral drug, Tamiflu or Relenza, so that once you take the antiviral drug, we will slow down the activity of the virus, so that your body can create enough antibody to kill the virus. You see, there's no medicine can kill the virus, but the medicine that we have, Tamiflu, and they can slow down the virus. So that the body have enough time to have the antibody to kill all the virus.
But can a patient insist on being tested for H1N1? Can a patient just come in, walk into the clinic, doctor says there's nothing wrong with you, but they still insist on being tested for the H1N1?
We have limited resources. We try. At the moment, we leave it to the doctor's discretion. I think it's better we leave it to the doctor's discretion, because doctor will be able to know whether you are normal flu or you are, because the symptom will tell you whether you are acute situation, you need to be tested H1N1.
Right.
You see?
That's actually another question.
And now we open up to more lab. In fact, now we also allow private lab to test H1N1. We asked UMMC, University of Malaysia's hospital, to also help the ministry to test this influenza A H1N1. So if they really want to test, they can go to a lot of private lab to test.
But actually, just back to that whole, I mean, we wouldn't want to blame on anyone. What seems to be the problem in fighting H1N1 in Malaysia? You seem to have a wonderful plan in place.
Yeah.
So, what seems to be the problem?
I would say that the public, after all this campaign, initially they thought that this is not deadly. This virus is mild. This virus is mild, so they thought it's okay, we get H1N1, they can recover in time. So they don't have this kind of urgency to take more precaution measures. But now I would like to say, I do not want to say that the virus is mild. I want to take away the word mild, because this virus is a new virus, I've said. Then the public now should know that this virus is deadly. Now we have 4 deaths. So this virus is deadly, and we have to, when they know that this virus is deadly, then they will take more precaution measures. Wearing masks, washing hands. If you have influenza-like illness, then you practice distancing measures. You have self-isolation. Maybe don't participate in functions, you know. And most of the big function, we hope that they have alcohol rub, they prepare, they let their participants to have hand wash. You know, all these must be measures, must be put in. We have said many times in the paper and through the media. But when I go to certain functions, I don't see, it's crowded places, but they don't have all this alcohol rub around. They don't in place any sanitizer. So we are saying that this is pandemic season. So all public function, be careful. You know, we have to protect our people. So if it's a congested public area, let's use more sanitizer and alcohol rub.
Yeah, it's just a simple step, right?
Yeah, simple step. That everybody aware that they have to clean their hand. They have to be more vigilant in view that this pandemic is widespread all over the world. Anywhere you go, it's not only Malaysia. Other countries the same, even worse.
Okay, with those words of advice, we'll be right back with Datuk Seri Liow Tiong Lai. Stay tuned.